Have you ever wondered what causes peptic ulcer disease? It's a common condition that affects millions around the globe, but the intricate mechanism behind it may surprise you. Peptic ulcer disease, or PUD for short, results from an imbalance between protective and destructive factors in the gastric mucosa, the lining of the stomach, and duodenum. This delicate balance can be tipped by a variety of risk factors, including infection with the bacterium known as H. pylori, the use of non-steroidal anti-inflammatory drugs or NSAIDs, having a first-degree relative with PUD, being an immigrant from a developed nation, or being of African American or Hispanic ethnicity. In peptic ulcers, a defect usually forms in the mucosa that extends to the muscularis mucosa, a thin layer of muscle. Once the protective superficial mucosal layer is damaged, the inner layers become susceptible to the harsh acidity of the stomach. Adding to the problem, the ability of the mucosal cells to secrete bicarbonate, which neutralizes stomach acid, is compromised. H. pylori, a bacterium that can colonize the gastric mucosa, plays a significant role in this process. It not only causes inflammation, but also impairs the secretion of bicarbonate, promoting acidity, and changes to the tissue known as gastric metaplasia. In terms of locations, gastric ulcers are most commonly found on the lesser curvature of the stomach, while duodenal ulcers are most common at the duodenal bulb. These ulcers are typically round to oval with a smooth base, but their appearance can vary depending on whether they're acute or chronic. The signs and symptoms of peptic ulcer disease can vary depending on the location of the disease and the patient's age. Gastric and duodenal ulcers can be differentiated by the timing of their symptoms in relation to meals. Symptoms such as unintentional weight loss, progressive dysphagia, overt gastrointestinal bleeding, iron deficiency anemia, recurrent vomiting, or a family history of upper gastrointestinal malignancy should prompt an urgent referral. Diagnosis of PUD requires history taking, physical examination, and various medical tests. Suspicion of PUD is raised by patient reports of epigastric abdominal pain, early satiety, and fullness following a meal. Gastric ulcers often result in pain a few hours after a meal and may result in weight loss, whereas the pain of duodenal ulcers decreases with a meal and can result in weight gain. The gold standard for PUD diagnosis is an esophagogastroduodenoscopy, or EGD, with sensitivity and specificity up to 90% in diagnosing gastric and duodenal ulcers. Other tests may include a barium swallow, blood work, and testing for H. pylori. In summary, peptic ulcer disease is a complex condition resulting from an imbalance in the stomach's protective and destructive forces, often driven by factors such as H. pylori infection and NSAID use. Through a combination of patient history, physical examination, and medical testing, healthcare professionals can accurately diagnose and treat this common yet intricate disease.